Ask Me Anything. For those that are new, I'm Dr. Twyman. I'm a board-certified cardiologist located in St. Louis, Missouri, and I focus on the early detection of cardiovascular disease and help people not have heart attacks and strokes. Now celebrating my 5th year in business at Apollo Cardiology. Thank you for those that came to our birthday party. We had it on Friday night here in St. Louis, out at Shaw Park. We had lovely weather. We had some great barbecue, so everybody got the protein in, and there were just great conversations had all night. So pretty much I appreciate everybody's showing up to our birthday party. So if you weren't able to make it this year, we'll do it again next year. It'll probably be the Friday after August 1st. That's our anniversary. So keep an eye out on the invitation for next year. So a little bit of a throwback. This was the original Apollo Cardiology logo. Apollo was the sun god. Obviously I've been talking about circadian biology for many years, wearing the blue, black, and glasses to train my circadian rhythms. So put Apollo inside the sun and made a logo. Ended up not using that one. Ended up using the one that you used to usually see, the one where you have a heart inside the sun. So we did give away some swag this year, so maybe I'll start making a little bit more Apollo Cardiology swag. We got some quarter zips currently, a couple t-shirts, and I think we're going to do some polos pretty soon. So keep an eye out for that if you're actually interested in that. I always thought it was funny that anybody other than myself or my team was actually wearing Apollo Cardiology gear. So there were some great questions tonight. Going to answer them. And if you have any questions that you didn't answer earlier, just drop them in the comments and I'll answer them as I can. We'll go to about 6:30 or so. Every Monday, 6 p.m. Central Time, we do this. I've been doing this for about 4 years now. So if you haven't had a chance to ask me a question, fire one up tonight. All right, a little bit of an interesting question. If I could have dinner with any 3 people in the health field, who would they be and why? That's our question. But probably number 1, probably to have dinner with my friend Dr. Gabrielle Lyon, chat about muscles and check medicine, discuss the intricacies of nitric oxide and athletic performance. She's been a good friend, good mentor, helped me get Apollo Cardiology off the ground. So Dr. Lyon would be a good person to have at dinner. Probably number 2, probably Dr. Mark Houston. He was a mentor of mine back in 2013. This is when I was still in traditional medicine. I was an invasive cardiologist for many years, treating heart attacks. Now I'm in the business of preventing them. Dr. Mark Houston had a course with the American Academy of Anti-Aging Medicine. It was an advanced cardiovascular module. There's 4 different modules. They were 3 days each over a year. It was hundreds of hours of education with him, and that's where I basically learned integrative functional cardiology. So he's absolutely a legend in the field of functional cardiology. If you don't know who he is, he's not super active on social media, but he does have some outstanding YouTube videos out there where he's been a guest on podcasts. So Dr. Mark Houston would be a good one. And third, that'd be controversial. I may be, having dinner at some point again in the future with Dr. Jack Cruz. I've hung out with him before at his farm in New Orleans. First met him in a biohacking conference in Munich, Germany, if that's a fun fact you want to know about. And then did do one of his events down in Cancun, Mexico back in 2020. So I've had dinner with Jack before. It's been a few years. I haven't really caught up with him since he moved down to El Salvador very much. But he's obviously got me into the circadian biology world and everything about photobiomodulation and talking about mitochondrial health. I initially was introduced to those topics from Dr. Jack Cruz. Any thoughts on the indoor grounding mats, the ones that plug into the outlet? I have covered this in the past, but no worries. This is always new members joining and following me online, which is always humbling. But I've used the grounding mats myself indoors. They usually come with a little plug you plug into the wall and says if it's grounded properly or not. It looked like my house was grounded appropriately, but 3 times that I used the device, I woke up in the middle of the night with crazy dreams and nightmares, and I never have those. So I ripped it off in the middle of the night and said never again. So I've never used it inside the house again. That being said, I've had some patients have some good success with it, saying that their sleep quality improved, that they have lower inflammation in their joints, that exercise is easier, more anecdotally than anything else for that part. But if you're going to do one, I would recommend, if possible, that you actually attach a copper wire. Sometimes you can use it with like an alligator clip and attach it to the map, and then run the copper wire outside your window and bury it actually into a copper plug in the ground, so you're truly grounded. That's the way I would do it if you could. And grounding, it's just helping bring free electrons into your system, so that helps lower oxidative stress and inflammation. It helps the mitochondria make energy without you having to eat food to make energy. There's a question, what brand of garlic do I recommend? It actually is called Kyloic. That is the brand name, and it's a particular age Japanese garlic. It's the aging process that gives it its anti-atherosclerotic properties. It's been helpful for regressing or shrinking plaques in the coronary arteries. There's a bottle that's green. There's a bottle that's gold. The gold bottle is a little bit more potent. Generally, the dose is nearly 600 milligrams twice a day. What is the most important thing a person can do to promote a healthy heart? It's an excellent question. Hard to say it in one sentence probably, but I'd probably say optimize your circadian rhythms and sleep like it's your job, because that is the key to a healthy heart and longevity. So start there. Question about bergamot for lowering ApoB. What are my thoughts? It's a weak it's a weak HMG co-reductase inhibitor, so it acts similar to a statin. It's the same enzyme that red yeast rice inhibits. It's not as potent or as strong as statins. Tends to have less side effects, of course. It's not going to cause any muscle symptoms, but it depends on where your ApoB is at a starting point. If it's going to have an effect, often, use it with more than just one thing. Monotherapy, it rarely works to get people to their goals. I use a decent amount of it in patients who are either statin intolerant or just hesitant to start statins, and say, okay, we'll give it a 3 to 4 month trial. If bergamot works for them, gets them the ApoB goals, I'll leave them alone. But if ApoB doesn't come to where you need it to be, then abandon bergamot and try a different plan. I think there's a double question, and I'll answer it in this part. Have I heard of the vitamin C and L-lysine protocol to clean out your arteries? Linus Pauling, the Nobel Peace Prize winner, and his vitamin C L-lysine therapy. Yes, I have heard the Pauling protocol. It's mostly used for patients with lipoprotein(a). It's more theoretical than it has any type of true data behind. The thought is that patients with elevated LPLA have collagen issues. If you do the Pauling protocol, you're giving the body vitamin C at high doses and L-lysine, and that competitively inhibits the binding sites for LPLA, and so it will not lower LPLA. There's no blood test you can look at that says the Pauling protocol is working. The only thing you can see is that potentially the arteries are not getting worse from where they are at the starting point. So you'd have to do probably a combination of testing. I probably would favor doing a carotid intima-medial thickness test to look at vascular inflammation and any soft or hard plaque in the carotid arteries, a calcium score, or a CT angiogram of the coronary arteries to look for plaque in the 3 major coronary arteries. And then if you're going to do the Pauling protocol, then repeating some type of imaging a year later to see did they get better or not. Not against it, it just doesn't have a lot of great data behind it. Question, can cholesterol-lowering medications just be stopped? First off, this is not medical advice. I can't give medical advice unless you're my patient. I see you at Apollo Cardiology, so you have to talk to the person who prescribed the cholesterol-lowering medications if this is something that they would recommend. But in generalities, there is no wean-off period. There are some medications that you cannot stop abruptly, otherwise you're going to have significant side effects. The lipid-lowering therapies tend not to be those ones. So yes, it is possible if you're having side effects, you come off of them, let the side effects wash off, and then they will decide if they're going to re-challenge with a lower dose of the medication or a different type of medication, and then reassess labs a few weeks to months after that. Question, what is the best red light to purchase for home? It's a good question. I don't know. Are you talking about this kind of light? So that's my new Amarin light. It's going to be the backstop for some of my videos. But it depends on what you're actually asking. Is probably for photo biomodulation lighting. If you're asking for those, on my website, drtwyman.com, I have some recommendations. But in my office and at home, I mainly use my EMR Tech devices. I have many of them. I have the EMR Tech Inferno at home. It's a quarter-size panel. Use that one relatively infrequently because at the office I have access to the Firehawk, which is an 8-foot tall panel, so it's a full body panel, so I could use that anytime I want at work. And then at home I also have the Firewave, which is the smaller box, about the size of a laptop or so, and you can kind of point that in any area that you need to treat. Fortunately, right now nothing's hurting, so I'm mostly just focused on treating the thorax, the chest. And it's a question about my EMR Tech. Do I only run the outer ring of the EMR Tech red light device all day for ambient red light? Yes, that is how I run it at my office. I have the Firewave in the corner and just have the outer rings on just to add ambient lighting back into the room because the glass filters out a certain percentage of infrared and red light. LPLA, what are your steps when this number is high? When LDL, I assume C, 110, but otherwise healthy. Also, the otherwise healthy is always debatable. Have they actually looked at the coronary arteries with a clearly CT angiogram? If you're a man and you're over 40, it's almost guaranteed you do actually have plaque in your arteries. I've never seen a man over the age of 40 not have plaque in his arteries if they do a clearly CT angiogram. So they may be healthy, they may be asymptomatic, but they have plaque, and LPA is probably the cause of it. So when you have elevated LPLA, at this time, there are not great treatment options to lower LPA directly. The PCSK9 inhibitors potentially lower it up to 30%. Somebody asked earlier about the Pauling protocol. People can consider the Pauling protocol with LPLA. It doesn't lower the number, but I will often check labs from Boston Heart Lab. There's a test called oxidized phospholipid ApoB. If that lab is elevated, that is cargo that LPA is carrying through the blood vessels. As is if LPPLA2 activity, which is an enzyme, if that's elevated or interleukin-6 is elevated, then LPA is more likely getting trapped in the arteries and causing inflammation in the arteries. So I look at those three labs. I will look at apolipoprotein B because ApoB is on the outside of the LDL particles, as is it on the outside of LPLA. So since you can't lower LPLA directly, you can lower ApoB with multiple agents. Statins, ezetimibe, PCSK9 inhibitors, Nexletol are the prescription medications. And supplements at times will help. Bergamot, reduced rice, berberine. Those are kind of the big ones that sometimes use. But look at the arteries themselves. Do you have an abnormal carotid intimal thickness scan? Do you have an abnormal calcium score? Do you have an abnormal clearly scan? Then that lets you know how aggressive to be with the other biomarkers on the blood work. All right, we're about 10 minutes in. I got a couple more questions that have been pre-submitted. I know some people are dropping questions in the comments. I'll answer those in just a moment. Thank you for those that are joining. For those that are new, I'm Dr. Twyman. I've been doing these AMAs for about 4 years now. I'm going to get a little bit more in-depth doing some long-form content on YouTube. That's my only ask tonight is if you don't already follow me on YouTube, just go to my website. It's YouTube. /@Dr. or I actually bought the domain. It says drtwyman.tv. It'll take you to my YouTube channel. I was playing around with it earlier today, changing some of the settings up, adding some different playlists. I have 2 main videos on there if you've not seen them before. How I interpret my own blood work. This is what patients see when they come to see me at Apollo Cardiology. They know that I've developed the skill to be able to read labs upside down while they're sitting in front of me at the table. But this is how I reviewed my own labs and how I think about what you would need to do based off any abnormalities on the labs. And then the second video I have on there, it's called No Time to Die, because vascular disease doesn't wait for you to kind of get all your affairs in order. You have to go looking for it and put out any fires. So the No Time to Die video has my kind of thoughts on what vascular testing should be completed and how to mitigate your risk of having a heart attack or stroke. So those 2 videos are kind of the mainstays on my YouTube channel right now. I'm working on some other long-form content there as well. I dropped a poll on the YouTube channel as well as in the threads here. So if there's other topics you want me to do that are more long form, then I can just answer in these AMAs. Just send me some messages and I'll start trying to rank order those for you guys. But back to the questions. All right. This is a little bit more challenging because I'm not an expert in electrophysiology. I'm more on lipidology, hypertension, atherosclerosis, but I can give you some basic ideas on this. Somebody was referred for an electrophysiology ablation study for a genetically caused atrial fibrillation, SVT, at looks like 24 years old. So any alternate treatments. So it really would depend. Is this supraventricular tachycardia or is this atrial fibrillation? Or is it actually both? Because they are treated differently. If it's supraventricular tachycardia, that's pretty much the standard of care, especially if you're symptomatic. It's usually a one and done ablation. You're, basically cured at that point. It's AFib, those are sometimes more challenging to fix with ablations. Sometimes you need more than one procedure to get a decent result. And the decent result is free of AFib 70 to 80% of the time. And so it really depends on how symptomatic you are. If you're highly symptomatic, then ablations may be higher up on the kind of the list of things to consider. There are rate controlling medicines, beta blockers, calcium channel blockers can be utilized, but those can come with side effects in younger people sometimes, particularly exercise intolerance, sometimes sexual side effects. And there's antiarrhythmics, which I'm not an expert in those anymore, so I defer to the electrophysiologist to recommend, medications such as propafenone or flecainide, but it depends on what arrhythmia you have. All right. And then, okay, what was the this year's party's grand prize? So we gave away a lot of goodies this year. We gave away some books, some of my favorite ones. Heart book from Dr. Patty, Dr. Lyon's book, Forever Strong. Gave away a circadian code book. Gave away a grounding book, and then there's also some kind of goodies inside the bag. And then if the person reads the book, they're going to get a 30-minute call with me to go over kind of a book club Q&A of what they learned in that book or whatever other topics they're interested in learning at that time. We gave away some swag, gave away some quarter zips with the Apollo Cardiology logo on it, gave away some carotid intimomedial thickness scans to let people know what their vascular age is, gave away some endopats to help people understand what their nitric oxide availability is, how healthy their arteries are. And then the grand prize was a 2-part deep dive with me. These are pretty in detail. It's a 4-hour kind of intake with me and my team, head-to-toe vascular screening, advanced blood work, 300-400 different biomarkers, genetics if you need it, and then a very detailed wellness plan of lifestyle interventions, any supplements that are recommended, and any medications to lower any vascular risk if needed. So that was the grand prize. All right. So those are the pre-submitted questions. Thank you as always. And I'll hit you up on any commented questions you guys dropped. Not an expert in this one, so I don't know the best way to kind of answer this one, but can I offer any insight into calming a histamine reaction from food? I probably would look at, if you're in St. Louis, there's many functional medicine providers that I work with. There's an organization called the St. Louis Institute of Integrated Medicine. If you're not from St. Louis, I probably would look at the Institute of Functional Medicine and find somebody who's gone through their programs to kind of work with that issue. All right, so somebody says that they live in Chicago, they're 55-year-old, in great shape, except they have AFib with rapid ventricular response. They've been cardioverted a couple times, and then maintained with metoprolol and flecainide. So metoprolol is a beta blocker to slow the heart rate down. Flecainide's an antiarrhythmic to try to keep people in sinus rhythm. But those medicines are slowing this person's heart rate and blood pressure. They ultimately had an ablation in late June. So I don't know what the question is particularly, is if that you're, okay, so you're not having more atrial fibrillation. That's unfortunately kind of the name of the game, I think, for this, is that, it's rarely one ablation and done for most people. There's usually a kind of, I call it, spot weld or touch-up ablation procedure 6 to 12 months after the initial one. And the person said that they would like to potentially come to St. Louis and become a patient, would be interested in working with you. I'm not an electrophysiologist, so I do not perform these procedures. So I always recommend people work with their local EP doctors if a procedure is going to be needed to be had. I would consider myself more of a consultant, an educator, somebody who can get to the root cause of what's potentially driving the rhythm issues, and then also definitely do a deep dive into your vascular health and try to work on that pathway. But often, I'm kind of the second cardiologist for these type of patients. But if you're interested in working with us, if you go to my website, it's drtwyman.com, and there's an application in the right-hand corner, and one of my team will set up a Zoom call with you and then talk about the logistics of potentially working with us. A lot of AFib questions tonight. So what is the best way to treat it? Is you want to look at what is potentially causing it. Is it high oxidative stress, high inflammation, microvascular disease with low nitric oxide? Is it heavy metals? Is it a thyroid issue? Is it another hormonal issue? Is it cortisol? Is it sleep apnea? Try to get to the root cause of what's driving it and pull on that lever if possible. Have I had time to evaluate the benefits of my portable sauna? Yes, I've used it in the wintertime. It works as well as my prior Impulse 3-person sauna that I had. So sauna is outstanding for structuring the water in your body. It's great for detoxification. It's great for relaxation. So highly recommend people consider saunas. And there are some portable kind of 1-person saunas. The one I use is the Relax Sauna. I have no affiliation with them. I just saw them at a conference and ended up buying it at the conference. All right. If you've been on a statin for 30 years, would you expect to see some plaque on a CT calcium test? My original test was a score of 90 at age 51. This put me at the 99th percentile, assuming this is common. Well, it sort of depends on what time frame did they add the statin. Was it before or after the calcium score test? So I'll take it both ways. If they added it after the calcium score test, often you're going to see the calcium score test go up. You're basically causing the soft plaque to become hard plaque, and then it will increase your calcium score test. Does not necessarily mean you're getting worse. You're taking the plaque that's more likely to cause a heart attack and stabilizing it. Now, if they started it before you had a calcium score test, then it is possible too that you started to calcify some of the plaques and then the calcium score test just picked it up. But if you live long enough, calcium score tests are often going to be positive. It's just what decade of life does it become positive? That's the key. If you're in your 50s, that's pretty early. So aggressive treatment to stabilize the glycocalyx and endothelial function, keep oxidative stress and inflammation low, and then use whatever tools you need to lower ApoB to at least less than the 20th percentile. So I like to see people's ApoB less than 70 in that situation. But if you want to know, do you still have soft plaque in your arteries, then that's where the clearly CT angiogram comes into effect. All right, so I think this is the person who was reporting that they had a lot of atrial fibrillation in Chicago, and they had a calcium score of 680. Okay, so anything over 400 is considered high risk. The calcium was on the outside of the arteries, so it's probably not on the outside. It's actually in the walls of the artery after the intima and the media layers. So the arteries get larger first. The lumen just doesn't occlude, and so you don't have significant stenosis in the arteries or blockage in the arteries, but you have a lot of plaque in the walls of the artery. So plaque, puts you at higher risk of events, and that's what you're trying to figure out is why is that much plaque present already. I don't know exactly how to answer this part, but what do I think about the quantum biology view of ketogenic low-carb diet? The basics are the basics. I want to know your maternal haplotype. I want to know where you live in the world, and it depends on what season it is. So that's how I would answer that. Ketogenic diets can work for some people, but you generally have to be uncoupled and generally at a northern latitude for it to be more optimized to work for those people. Someone's asking, can your cholesterol numbers be too low with hyperlipidemia? LPA, I think they're saying that they're on ezetimibe and 5 of Crestor, which is a statin. They had optimal levels on ApoB on a Boston Heart Lab 6 months ago. So cholesterol is a molecule that without you having certain levels of, you will not be alive. But the cholesterol numbers you're speaking of are the blood levels. What is actively floating through the blood at any one time in the transporters. And the answer for that is probably not too low. But if you've had the Boston Heart Lab, you can look at a lab on the top right corner in the cholesterol balance part of the test and look at desmosterol, D-E-S-mosterol. If desmosterol is very low, then there's some theoretical risk that it may cause issues with brain function and the cholesterol that's in the brain circulation. So you may want to back off on therapies at that point. But the goal is to lower ApoB to whatever your doctor's targets are. Often, I may shoot people for 55 if they're very high risk. I've had some patients who have genetic abnormalities and their levels are 43 without any meds. And I've seen some patients on triple therapy, so a statin, ezetimibe, and a PCSK9 inhibitor with ApoBs in the 20s with no untoward side effects. So it all is individualized. All right. So I think I got through the rest of the commented questions and got you guys on time here. So I appreciate your guys' time and attention tonight. I will be back next Monday, 6 p.m. Central Time, to answer your questions. Of note, I did put a poll in my IG thread. So for some topics, if you want me to do some more longer form videos, please vote there. You can also vote on that same poll on my YouTube channel. That's drtwyman.tv. That is where I have 2 videos. One called No Time to Die, which walks you through the entire process I think about for vascular health, how to screen for soft plaque, how to screen for hard plaque, what treatment options to consider. And then I also have a video up there called How a Cardiologist Interprets His Own Labs. So I walk you through myself reading my own Cleveland Heart Labs, and I tell you how I think about the different pathways, oxidative stress, inflammation, lipoproteins, nitric oxide pathways. So if you're interested in how we kind of practice medicine at Apollo Cardiology, that's a good starting point to look at is how we do it in those 2 videos. So hope you guys have a great week, and I'll see you next time.